So for week 1, we discussed bones and bony landmarks. We'll be starting from the top and working our way to the bottom. So beginning with the skull here, or your head, you also have your mandible or your jaw. Its bony landmarks that you will need to memorize are its zygomatic arch, which is also known as your cheekbone, your mastoid process, so this pointy piece directly behind the ear, and then finally the occipital ridge here, which kind of connects both the top of the skull and the base of the skull. Next we'll be moving on to the vertebral column. It contains 7 cervical, 1, 2, 3, 4, 5, 6, 7, 12 thoracic, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12, and 5 lumbar, 1, 2, 3, 4, 5. A good way to remember that is 7 for breakfast, 12 for lunch, 5 for dinner. Both the sacrum and the coccyx are included within the vertebral column as well. It is divided into 2 different processes. You have the spinous process, which is directly down the middle, and on each side of the vertebrae are its transverse processes. Moving back to the front of the skeleton, you have your clavicle here, and then all of your thoracic vertebrae, they all attach to the ribs, which then attaches to the sternum. The sternum is divided into the manubrium, this is the base, and then this is your xiphoid process. There are 12 ribs, and then the clavicle then comes around and meets to your scapula here. I like to find the spine of the scapula first, that's the easiest. If we take that and move to the front, and the point that meets the clavicle, this is your acromion process. Underneath that is your coracoid process. Moving back to the back, above the spine of the scapula, here you have the supraspinous fossa, supra meaning above, so we're above the spine, and that is a fossa. Directly below it is the infraspinous fossa. There are 2 borders to the scapula. Here you have the medial border, and if you take that medial border and come all the way to this top point, that is the superior angle, and if you follow that all the way down, here you have the inferior angle. And then you have the lateral border of the scapula. On the lateral side of the skeleton, where the ball and socket joint is, the socket part is called the glenoid fossa, and directly above it is the supraglenoid tubercle, and directly below it is the infraglenoid tubercle. And then finally, the last bony landmark is on the anterior side of that skeleton is the subscapular fossa. Moving to the arms, making sure we're always in anatomical position, I like to find the bicipital groove, making sure that is front and center. So here's that bicipital groove that separates the greater and lesser tubercles. On the lateral side or on the outside will be your greater tubercle. On the medial or on the inside will be your lesser tubercle. On the lateral side of the humerus, so here's your humerus, on the lateral side, about halfway is going to be your deltoid tuberosity. Depending on the skeleton, it might be a little bit harder to find, but as long as you are like pointing directly at it, so lateral about halfway, you should be on it. It's very tiny, and sometimes the molding process, it doesn't always show. On the distal end of the humerus, you have your epicondyles. So here you have your medial epicondyle because it's closest to the midline, and then you have your lateral epicondyle. So you have your lateral supracondylar ridge for your final bony landmark. So lateral meaning on the outside, supra meaning above, and it'll be a ridge. So lateral supracondylar ridge. And then moving on to the forearms, you have the ulna and the radius. The ulna is going to be on your pinky side or on the medial side here, and then the radius is going to be on your thumb side. If you are unsure what the thumb is the only phalange with 2 bones. So onto the ulna, so on the medial side of the forearm. On the back of it, at the very top, is your olecranon process, also known as your elbow. On the anterior side of it, and on the proximal end of that bone, there are 2 little bumps, and sometimes it'll show 1 bump. That is your ulnar tuberosity. And then onto your radius, at the very top, on the anterior side, is a bump here, and that is your radial tuberosity. And all the way at the distal end here is your styloid process. You also have several irregular shaped bones here. Those are your carpals. Directly above it will be your metacarpals here. There are 5 of them. And then you have your phalanges. So moving on to the pelvis. At the very top of the pelvis is your iliac crest. We'll follow that iliac crest all the way to the back and to these 2 points, and this is your PSIS, or your posterior superior iliac spine. Moving back along the iliac crest, we'll move to the front and follow that all the way down to this first point here, and then this will be your ASIS, or your anterior superior iliac spine. And then moving down to the final point here at the bottom, this is your AIIS, or your anterior inferior iliac spine. In the front, or the anterior side here, you have your iliac fossa. The cartilage is called your pubic symphysis, and directly on the sides of it is your pubic crest. Moving to the back, here is your ilium, and then these 2 hooked shaped bones. This is your ischium, so these are your sit bones, what you sit on, and there are some irregular shaped bones here, and those are called your ischial tuberosities. Moving on to the lower legs, here you have your femur. On the side of the femur, on the lateral side here, is your greater trochanter. On the inside, or the medial side, is your lesser trochanter. Moving all the way down to the posterior side of the femur, you will have these 2 rounded knuckle-like shapes. These are your condyles, and so you have your medial condyle, which is closer to the midline, and then your lateral condyle. Moving to the lower legs, you have the tibia and fibula. We like to call this big tib, little fib. The tibia is going to be on the medial side, where the fibula is going to be on the lateral side. Moving to the tibia, at the very top here is this bump. That is your tibial tuberosity. And all the way down on the distal end is going to be your medial malleolus. And then moving to the fibula, at the very top of it, this is called the head of the fibula. And then following that all the way down to its distal end, it will be the lateral malleolus. And just like your hands, you have some irregular shaped bones here. This is called your tarsals. The only tarsal name that you will need to know is your calcaneus. And again, just like your hands, you have 5 metatarsals on each foot, and then your toes are your phalanges. And that's it.